Hello everyone, in this class we'll try to learn about the regional circulation. The learning objectives are to understand the importance of regional circulations, give the normal values of blood flow which are expressed in terms of ml per 100 gram per minute to important visceral organs, learn the local control system of peripheral blood flow, explain the mechanism and importance of autoregulation of blood flow, and understand how integrated regulation of the cardiovascular system is essential for stable body functions, uh, various organs of the body. The primary objective of circulation is to supply oxygen and nutrients to various organs and tissues of the body and to remove carbon dioxide and metabolites from the tissues, which is effectively achieved by distributing the cardiac output. One of the fundamental functions of circulatory function is the ability of each tissue to control its blood flow locally in proportional to its metabolic needs. However, certain organs have special requirements and accordingly they have special arrangement of the blood supply to its regulation. The blood flow to the different organs. The blood flow is expressed in unit time per unit weight of the tissue and is maximum to the carotid body, which is around 200 ml per 100 gram per minute, and it is minimum in skeletal muscles, that is 2.5 ml per 100 gram per minute. Among the organs, flow is maximum to the kidney, it is around 420, followed by heart, it is around 84, and then liver around 58, and then to the brain around 54 ml per 100 gram per minute. These are special arrangements of blood vessels. There are special arrangements of blood vessels and special regulatory mechanisms in these organs to meet the metabolic requirements. This chart shows the amount of blood flow to the each organ and the oxygen consumption. If you see the blood flow per 100 gram of tissue per minute, it is maximum in the kidney, followed by heart, liver, then brain. If you see the maximum oxygen consumption per 100 gram per minute, then it is highest for the heart, followed by the kidneys. Regulation of the local blood flow. The amount of blood flowing through the organs depends mainly on the diameter of artery and arterioles supplying the organs. If the vessels are dilated, blood flow increases, and if the vessels are constricted, the blood flow decreases. Diameter of vessels supplying an organ depends on the state of sympathetic and parasympathetic discharge to that organ. However, many organs regulate their blood flow according to their need via autoregulatory mechanisms. There are different types of regulations. It can be intrinsic regulation or extrinsic regulation. Intrinsic regulation can be autoregulation, and it can be endothelium mediated regulation. Autoregulation is defined as the capacity of tissues to regulate their own blood flow without any external influence. Normally, blood flow to organs remains relatively constant within mean arterial pressure range of around 60 to 100 mm of Hg. The theories of autoregulation of the blood flow are myogenic theory, metabolic theory, and tissue pressure theory. This is how the blood pressure, it's almost going to be remain constant from the range of around 60 to around 180 mm of Hg. Okay. Myogenic theory. According to myogenic theory, the vascular smooth muscles contract in response to increased transmural pressure and relax in response to decreased transmural pressure. When perfusion pressure increases abruptly, the initial blood flow to the organ increases. However, increased pressure distends the vessels that causes contraction of the vascular smooth muscles. Vasoconstriction decreases the blood flow and returns blood flow to the previous levels. Degree of constriction is proportional to the degree of distending pressure. Metabolic theory. The blood flow to organ or tissue is controlled by metabolic activity of the tissue. When blood flow decreases to the tissue, decreases oxygen supply results in formation of the vasodilator metabolites that dilate the blood vessels and restore blood flow. The metabolites formed in the tissue act locally to dilate the resistance vessels. Blood flow proportionately increases with increase in the rate of metabolism. Also, when metabolic activity increases, the metabolites accumulated in the tissue causes vasodilatation that increases the blood flow. This helps to wash out the metabolites from the tissue. The known metabolic vasodilators are lactic acid, carbon dioxide, hypoxia, hydrogen ion, potassium ion, inorganic phosphate, interstitial fluid osmolarity, adenosine, and the local temperature. Role of adenosine. Adenosine is an important local vasodilator for controlling regional blood flow. For example, adenosine released from the cardiac myocytes when coronary blood flow is less causes local vasodilatation in the heart and reestablishes the coronary blood flow back to the normal. Also, when metabolic activity is more, degradation of adenosine phosphate, that is ATP, increases the release of adenosine that in turn causes vasodilatation and increased blood supply. Reactive hyperemia occurs when the blood flow is re-established to organ or tissue following a brief period of arterial occlusion. The flow becomes more to the organ or tissues. This is how the metabolism is going to regulate the blood flow. As the rate of metabolism increased metabolites are produced, they are going to increase the amount of blood coming to the tissues. Tissue perfusion theory. When perfusion pressure increases, the blood flow increases, which in turn increases the capillary permeability due to increased hydrostatic pressure. Increased blood flow increases interstitial pressure. When tissue pressure increases significantly, blood vessels is compressed passively from outside that decreases the blood flow to the tissue and restores normalcy of blood flow. Coming to the endothelium mediated regulation of the blood flow. Endothelium of the blood vessels secrete vasoactive substances like endothelins and vasorelaxing substances like endothelium derived relaxing factor, that is EDRF, or nitric oxide. These chemicals are secreted in various situations to alter the blood flow locally according to the need of organ or tissue. Nitric oxide plays a big role in the regulation of the local blood flow. Then extrinsic regulation, the factors affecting from outside, mainly the neural regulation. Sympathetic stimulation causes vasoconstriction and decreases the blood flow, whereas parasympathetic stimulation causes vasodilatation and increases blood flow. Vascular reflexes, some activation of various cardiovascular reflexes like baroreceptor reflex or chemoreceptor reflex control blood flow by altering the diameter of the resistance vessels. Another extrinsic mechanism is hormonal regulation. Hormones that act on the beta receptors like epinephrine cause vasodilatation and increase the local blood flow, and hormones that act on alpha receptors like norepinephrine causes vasoconstriction and decrease the blood flow. Release of local hormones such as substance P, histamine, and bradykinin control local blood flow. Stimulation of cholinergic and histaminergic receptors also causes vasodilatation and increases blood flow. So this is in brief about the basics principles of local regulation of the blood flow. Thank you.